Coming to the malignant arteritis externa. Aishwarya Lakshmi, what is malignant arteritis externa?
Ma'am?
Tell me about malignant arteritis externa. What is it? Where it comes? Ear, nose, or throat?
Here, ma'am.
Okay. Tell me some points or 1 or 2 points about the arteritis externa, malignant arteritis externa.
It causes excruciating pain, mostly common in diabetic patients.
Very good.
It involves the external auditory canal. It is mostly a am I audible?
Yeah. Yeah, audible.
It's mostly a complication of external otitis media, externa.
Okay. So it is a condition which occurs in a diabetic patient or immunocompromised patient. It affects the external artery canal. Especially it involves the bone. That is why the patient will be having severe excruciating pain during night time. So this condition is otherwise called necrotizing arteritis externa, which is mainly caused by pseudomonas infection. Patient will be having purulent, greenish purulent discharge. Okay. So the typically the patient will complain of pain in the night. Okay. So next coming to the nerve of Duisburg. Nerve of Duisburg is otherwise called nervus intermedius, which is a part of facial nerve which carries the sensory as well as parasympathetic fibers. Okay. So next point is Ajay, Sarji Ajay. Yeah. Retropharyngeal nodes, where it is present?
Behind the pharynx.
Behind the pharynx. Will it comes in the valvular ring or not? Which part of the valvular ring? How many rings are there in the valvular ring?
External and
Louder.
internal. External and internal ring.
Very good. So this retropharyngeal node, where it presents?
External ring.
Okay. So the node of Rubier is the most superior node of the lateral group of retropharyngeal node. So there one part of the retropharyngeal node is called node of Rubier, which is most superior and lateral. Okay. There's no. So are we able to palpate the retropharyngeal node, Akash Kumar?
No, ma'am, we cannot palpate.
So how it can be diagnosed if it is enlarged?
Ma'am, we can see if there is any retropharyngeal abscess or parapharyngeal tumors.
Yeah, how it can be diagnosed?
By lateral X-ray, ma'am.
Lateral X-ray. Okay, then. You read about it, okay? It is again
Yes,
a mega question. Partially correct. Please read about it. Okay.
Yes,
Coming to the noise-induced hearing loss. So noise-induced hearing loss, you all know, due to the excessive or prolonged exposure of loud sound, the patient may develop the noise-induced hearing loss. Okay. Typically, the audiometry, that is pure tone audiometry, shows the tip at the 4,000 kilohertz. 4,000 kilohertz is not always like it should be the 4,000. It may range from 4,000 to 8,000. It indicates that there is a high frequency hearing loss. Okay. So coming to the Hirschberger sign, this is being asked regularly. Okay. So Hirschberger sign. What is Hirschberger sign? It is numbness in the posterior meatal wall, which is seen in the acoustic neuroma. Okay. This posterior meatal wall, which is supplied by 7th cranial nerve. It is especially seen in the acoustic neuroma. Patient won't complain that I'm having this wall numbness and all. If we do, when we do caloric test, that time patient won't be having any sensation. Whether we are using the cold water or hot water, they won't be having, or a touch sensation won't be there. Okay. That typical sign of that involvement of 7th cranial nerve seen in the acoustic neuroma. This otherwise called Hirschberger sign. Okay. So coming to the next syndrome, Artner syndrome. Artner syndrome is a paralysis of recurrent angina and cardiomegaly. So actually, the syndrome presents as paralysis of recurrent angina and cardiomegaly due to the some esophageal pathology. Okay. Aortic capsule. Kirti Vasan, what is aortic capsule? Embryology question. What is aortic capsule? Aortic capsule.
Forms of a foot plate, ma'am. Bony labyrinth.
No. See, aortic capsule is the name from where only all our inner ear, the bony part of the inner ear, no, it develops. Aortic capsule is like a name, okay, embryological name from where only all our inner ear bony structure develops. Okay, it's also called bony labyrinth, which ossifies from 14 centers separately. Okay, ossification starts in the 16th week and ends by 21st week. Is read about aortic capsule in embryology, IBC.
Okay.
Yeah, you can unmute yourself. Veerapartha Sarathi. Veerapartha Sarathi.
Ma'am.
Yeah, what is
Yes, ma'am.
Plummer-Wilson syndrome? What is Plummer-Wilson syndrome?
Ma'am, will be there, iron deficiency anemia will be there, cholecystitis will be there.
Okay.
Hello, ma'am.
Okay. See, Plummer-Wilson syndrome is otherwise called Patterson-Baum-Kelly syndrome. So they may ask you either of these names, and you should be aware of. Okay, they will ask you in a short form. So there are two names for Plummer-Wilson syndrome. It consists of iron deficiency anemia. The patient may present with the iron deficiency anemia, dysphagia. Especially they will come to the ENT department for dysphagia, difficulty in swallowing. Phylonekia. Phylonekia means there is a spoon-shaped nail in the toe or in the fingers. Okay, and angular cheilitis. There is a lesion in the angle of the mouth. So these all forms a Plummer-Wilson syndrome. So why we are so much worried about this syndrome? Because this syndrome, if we don't treat it properly, means the patient may develop post-cricket carcinoma. Okay, post-cricket wave, following which post-cricket carcinoma. So if they ask you post-cricket carcinoma, you can write this syndrome there. Next, Pemberton maneuver. Okay, see, this is an important maneuver. It will be used in your medicine, like surgery. Yeah, surgery. Pemberton maneuver. See, in thyroid mass, if you able to usually thyroid mass will be visible outside. Okay, sometimes the thyroid mass won't be visible, or like it is hidden behind the sternum, the lower part of the sternum. Okay, that is called substernal extension of the thyroid mass in case of thyromegaly. Okay, so in such case, we do the test called Pemberton test. What will you do? We'll ask the patient to raise the arms, okay, above the chest level or head level. The patient will be, if they do so, what happens is the mass, no, if the mass is so big, means it will go and compress that venous structure, like vena cava there, and causes a venous distension, so that the patient may present with the venous congestion, upper part of the chest, face and upper part of the chest, they may develop the distension of the veins and facial congestion, or the color change, or some suffocation is they will be having some discomfort. Okay, respiratory discomfort, venous distension of the neck veins, as well as suffocation of the vein, that is congestion of the face. So these are all due to the compression of the thyroid mass, which is hidden behind the sternum. Okay, when they ask to do the Pemberton's test, it is indicated. So without ultrasound, we can diagnose the substernal extension by using this test. That is the idea of this test. Next is a Peary-Robin syndrome. Peary-Robin syndrome would have written pediatrics. Okay, so it is a triad of micrognathia. Micrognathia means small mandible. Okay, underdeveloped mandible. Glossoptosis. Glossoptosis is nothing but posterior displacement of tongue and cleft palate. All these triad forms the Peary-Robin syndrome. So, in case of posterior displacement of tongue or micrognathia, patient may develop the respiratory problem. So, they may come to the ENT department. Okay. Coming to the muscle of larynx. Okay, posterior cricoid. This is the only muscle you need to by heart. This is the only muscle which is the abductor of the larynx. Okay, which is supplied by the recurrent angina. Radke's pouch. So again, what is Radke's pouch? Gavistry. Kavistria, Gavistria. Kavistry. Kavistry. What is Radke's pouch?
Diverticulum of the nasopharyngeal.
What is Radke's pouch? Embryologically, what is Radke's pouch? Where it presents? Tell the embryological answer for me. Balaji?
Ma'am,
Yeah,
Rathke's pouch forms the anterior pituitary. Ma'am, Rathke's pouch is the embryological remnant from which the anterior pituitary gland will move from the nasopharynx to the sella turcica, to the adult side, ma'am. It is a remnant of the pituitary gland.
Okay. So it is a remnant, okay. So it leaves some diverticulum in the nasopharyngeal mucosa which forms a pit, okay. Sometimes these canal won't get closed and it persists in the adult life. If it is persists so, craniopharyngioma, there will be a connection between the cranium and the pharynx. So this presents as a craniopharyngioma. Okay, so mass of the next. Recruitment. So recruitment is an audiological term. You need to know about the definition. Define recruitment means you need to tell it is an abnormal growth in the loudness already seen in the cochlear lesion. Recruitment is a test actually. Recruitment is a test which measures the abnormal loudness, abnormal growth or difference in the abnormality of the loudness in the patient. So it is specifically positive in the cochlear lesion. So it will help to differentiate the cochlear and retrocochlear lesion. Okay. Okay, coming to the recurrent angina. So recurrent angina supplies almost all the muscles of the larynx except the cricothyroid muscle, which is very important muscle in ENT, cricothyroid, which is supplied by the external branch of the superior laryngeal nerve or external laryngeal nerve. Okay, so anatomy question. What is rhinophyma, Janani? Where it comes? Rhinophyma.
It is in the ear, ma'am. And it is due to sebaceous gland.
Yeah. அங்க பார்த்து கூடமா பார்க்க தெரியாது இதுல ஒழுங்கா சொல்லலையே. ஓகே ஜனனி ரைனோஃபைமா என்னம்மா ஜனனி இப்படி பண்ணிட்டே நீ பார்த்து படிக்கிறதுல என்ன கஷ்டம் இயர்ல இருக்குமா have you seen the picture of rhinophyma once you see the picture of rhinophyma in figura you won't tell like this they will definitely fail you in viva if you tell it is in ear so big picture will be the rhinophyma sarcastic picture will be there in the thing. Okay. Rhinophyma is due to hypertrophy of sebaceous gland. Okay. Usually the students will tell some other gland. It is a hypertrophy of sebaceous gland usually present in the tip of the nose. Okay. It is otherwise called acne rosacea. Usually in adolescent age or adult male or female, they tend to develop a small cyst or something like that. If they do something with our do something with a nail or something, some injury to that, sometimes it develops, okay, rhinophyma or some without injury also it will develop due to the infected or hypertrophic sebaceous gland, which is otherwise called acne rosacea. Okay. So treatment is, what is the treatment for rhinophyma, Sangavi?
Excision of the tumor, ma'am.
Yeah, paring. The name is paring. Paring of the tumor or excision of the tumor. Okay, next is rhinoscleroma. Russell bodies are seen in the rhinoscleroma. This is again a short one. Okay, so Russell bodies are nothing but other name or modified name for plasma cells which contains the eosinophilic structures within it. Okay, it is a histopathological finding present or seen in the rhinoscleroma. They contain immunoglobulin which are secreted with plasma cells. Plasma cells means immunoglobulins only. Okay, so it is a plasma cell basically which contains a eosinophil within it, which is seen by histology or microscopically histology. Okay, this already I told you, no? Soumya, tell me sample trial. Already discussed last class. Triad of Samples triad. Yeah, triad. Louder.
Aspirin sensitivity.
We are not able to hear you. What is Samples triad? Srinidhi. Srinidhi. What is Samples triad?
Ma'am, it is a triad of bronchial asthma, nasal polyp, and aspirin intolerance, ma'am.
Very good. Good. So Samples triad is already explained. Okay. So next is shaman bodies. Shaman bodies are same like other bodies. This is seen microscopically, seen in especially sarcod granuloma. Sarcod granuloma. Why are we bothered about Krishna Kumar? Where it comes sarcod granuloma in ENT? Here nose or throat. Where it comes?
Throat, ma'am.
Throat. Which part of the throat, man? Go and read. Granulomatous lesion of the nose. It is a separate long question for you, short or long question. So go and read the granulomatous lesion of the nose. It is given there. So shaman bodies are seen as the sarcod granuloma. Okay. So next comes a very, very important name, Schneiderian membrane, which is a mucosa, which is other name for respiratory mucosa of the nose. So definitely they will ask you in Viva. By heart the spelling, Schneiderian membrane. Spelling you need to by heart. Okay. It is other name for respiratory mucosa. Respiratory mucosa is lined by ciliated pulmonary epithelium. Next. Sri Ranjay.
Ma'am.
What is Schwarz sign?
It's a pink reflex seen through an intact tympanic membrane.
Seen in which condition?
Otosclerosis.
Very good. Okay, so it is a flamingo pink or pinkish hue seen behind the intact tympanic membrane on otoscopy examination. Okay, which is seen in active otosclerosis. It indicates that the otosclerosis is very active. Okay, especially it happens in females. No, it is most common in female. It will be seen. This Schwarz sign is very common in pregnancy. During pregnancy, all conditions are exaggerated. Likewise, the otosclerosis will also become active during the pregnancy. Okay, so this is called Schwarz sign. So next is a sinodural angle, which is not important for you. Okay, anyway, sinodural angle is otherwise called Civilis angle. It is situated between the sigmoid sinus and middle fossa dura plate, which is actually seen during the surgery. Okay, sinodural angle is seen during the mastoid surgery, while doing partial mastectomy. The sinus plate and dural plate will be present. The angle which forms is called Civilis angle or sinodural angle. Okay, which is very important. You should not damage it during the surgery. Simple syndrome we all know, no? So you would have read in pediatrics and medicine. So it is consists of medullary carcinoma of thyroid, chromocytoma, parathyroid hyperplasia, or adenoma. So we are worried about parathyroid hyperplasia or adenoma. Okay, and medullary carcinoma of thyroid. In case of thyroid carcinomas, especially medullary thyroid carcinoma, we need to rule out other associated conditions like pheochromocytoma and parathyroid adenoma. So in medullary thyroid carcinoma, if you suspect medullary thyroid carcinoma, the whole family should be screened for these conditions. Okay, this is called simple syndrome. Coming to the name, fancy name called Schluter's neuralgia. Again, it is important. It is a neurological pain present at the half of the face with the nasal congestion. Nasal congestion staphylococcus, rhinorrhea, and increased lacrimation. This is due to neuralgia of sphenopalatine ganglia. Okay, compression of the nerve. Okay. Next is a solid angle. Solid angle is nothing but see the three bony semicircular canal present, no, which converge into one point. That angle is called solid angle. Semicircular canal meets all the three semicircular canal meets in one point. That angle is called solid angle. Yes. Next is important. Please be attentive. Tolosa-Hunt syndrome, which is actually due to the cavernous sinus involvement. What do you mean by cavernous sinus? Prakadesh Kumarvel. What is cavernous sinus? Where it is present? In what way it is related to ENT? Louder, please. Prakadesh Kumarvel. Unmute yourself. Yeah, louder. What is cavernous sinus? Where it is present? What way it is related to ENT? Fast. You don't know?
Dural venous sinus.
Good. Okay. Where it is present? Landmarks. Shilpa? Yeah. What is cavernous sinus? Lateral wall of cavernous sinus forms which are the important structure?
Cavernous sinus, lateral forms sphenoid bone, and there is sphenoid sinus nearby, so there can be any.
By this way it is related. Okay, what is the lateral wall of cavernous sinus? The neurological structure, important neurological structure.
There is nerves are third, fourth.
3, 4, and 6, as well as 5th cranial nerve are related to the lateral wall. So, any granulation tissue in the cavernous sinus or superior orbital fissure or in the orbit which presents as a unilateral. If it is present at the that side means right side, unilateral orbital vein with the involvement of 3, 4, 6 cranial nerves. Why you understood? Granulation tissue or thrombosis or something like that. So, any problem in the lateral wall of that cavernous sinus or supraorbital fissure or orbit, these are all the closely related structures. So, any problem in this area will cause Tolosa-Hunt syndrome, which presents as unilateral orbital pain along with the 3 cranial nerve involvement, especially extraocular movements will be affected. Okay. So, coming to the tone decay. Tone decay is an audiological term which is otherwise called auditory flitting. Okay. It is a change in the auditory threshold when a continuous tone is present to the ear. So, this is one of the tests which is it is seen in the acoustic neuroma and other retrocochlear lesions. So, it is a test for retrocochlear pathology, just to identify the retrocochlear pathology. Recruitment is a test for cochlear pathology. Tone decay is a test for retrocochlear pathology. This much you know means it's well and good. Trotman triangle. Already explained about Libidin. What is Trotman triangle? What is the importance of Trotman triangle?
It is a triangle in the inner ear.
Triangular?
Inner ear.
That's all you know. 1 minute, within a minute you can read that. Okay. So it is bounded by the boundaries of Trotman triangle is important. Okay. So it is bounded by the bony labyrinth, anteriorly labyrinth. Okay. It is posteriorly sigmoid sinus, and the diaphragm are superior pedunculated sinus superiorly. So this triangle is important in case of Trotman triangle is important in case of that. What is that? Sap decompression. Yeah. It is very important triangle present in the petrous bone. So identify the semicircular canal, especially the semicircular. Next one is stratus triad. Last time I explained, you know. Sona, what is stratus? Stratus syndrome. Sona Kumari. So it is a triad. You know about it? Tell me.
Ma'am, it is characterized by the immobility of the soft palate and conductive hearing loss.
Seen in which condition? Seen in which condition?
Nasopharyngeal carcinoma, ma'am.
Very good. So nasopharyngeal carcinoma. This triad is important. This syndrome is important in case of nasopharyngeal carcinoma. Usually nasopharyngeal carcinoma present as a mass in the nasopharynx and choana. Okay. So it won't be visible outside, or it won't. The space is very big. The patient won't be having straight direct complaints that I'm having a mass or a problem in the nasopharynx. So the patient will be presenting with the non-specific complaints like conductive hearing loss due to the occlusion of eustachian tube, due to the mass. Second is ipsilateral immobility of the soft palate. Okay, so the palate won't be able to move freely. The soft palate, no, even both sides of the uvula, it won't be able to move properly. Neurological pain in the distribution of mandibular division of the cranium. So the patient may present with trismus and preauricular fullness. This syndrome is Okay, the other name for sinus of Morgagni because it's actually the mass is occluding the sinus of Morgagni. Okay, last class sinus of Morgagni somebody don't know. Yeah, that area is occluded by this mass. So the three symptoms, non-specific symptoms the patient will present, you should be aware of Rota syndrome and riot. Julio phenomena. Julio phenomena is a loud sound produces a vertigo. Sudden loud sound produces vertigo or giddiness in the patient. Okay. It is seen in congenital syphilis or where the what happens actually is usually two windows are present, round window, oval window. In this patient, there is an extra window which is nothing but a fistula, a hole in the semicircular canal, or fenestration present in the foot plate of the stapes. That is the third window. Okay. In that case, loudness produces whenever the patient will hear the loud sound or they don't hear the loudspeaker, they may develop a giddiness or vertigo. This is not Julio phenomenon. This is the congenital syphilis. Turban epiglottis. Turban epiglottis is due to the edema, the infiltration of the epiglottis, and it is caused in the upper in the laryngeal tuberculosis. So lupus is a form of tuberculosis. Again destroys the epiglottis. You see the lupus again seen in the tuberculosis of epiglottis. Yeah, at this point you know no tympanic brain. Let me ask you a question. Haripriya. Yeah. What are the layers of tympanic membrane? Unmute yourself.
Yes, ma'am.
What are the layers of tympanic membrane? Embryological layers of tympanic membrane?
A mucosal layer. A
Mucosal
fibrosal layer. Fibrosal layer. Very bad. You are seeing the phone and doing chit-chatting somewhere. No, ma'am.
Mucosal layer, which layer? Mucosal layer.
Inner mucosal layer, ma'am.
Come and tell.
Inner mucosal, middle fibrous layer, ma'am.
And outer layer?
Outer epithelial layer, ma'am.
So, this everyone should know. Okay, very basic questions I did. Ventricle of Morgagni is synonymous to the laryngeal ventricle. This is very important. Please be aware of that laryngeal ventricle. So there is a space or a structure which is seen between the true cord and false cord. What is laryngeal ventricle? The space which is seen between the true cord and false cord is the laryngeal ventricle, which is other is called ventricle of Morgagni. Okay. It is not sinus of Morgagni. Sinus is different. Sinus of Morgagni is present in the near the skull base, that is the quina near the trachea. Ventricle of Morgagni is seen in the larynx, vocal cord. Okay. So ombronasal organ, it is a vestigial structure related to the smell. Okay. So sometimes in our human, some patients will be having, our normal patients will be having a small pit. This is a remnant of ombronasal organ, which is present in the anterior inferior part of the nasal septum. So while doing the diagnostic nasal endoscopy, sometimes they may come across ombronasal organ pit. Coming to the Wallenberg syndrome, which is important syndrome. So it is mainly due to the pica, posto-inferior cerebellar artery syndrome, okay, or lateral medullary syndrome. It is due to the thrombosis of pica, posto-inferior cerebellar artery, causing the ischemia of the lateral part of the medulla. So it may produce vertigo, nausea, vomiting, Horner syndrome, dysphagia, and dysphonia. Sometimes ataxia. Ataxia with a tendency to fall because involvement of cerebellum. Patient do have ataxia, the tendency to fall to the involved side, and lateral spinal column tract is also involved here. So that's why loss of pain and temperature sensation on the deep side of the face and contralateral side of the limb. Okay. So if you remember the tract, you can easily write this. Okay. Our thing is concern is nausea, vomiting, vertigo, and Horner syndrome, and dysphagia, and dysphonia. All these things are ENT presentation, and the two are neurological presentation. Wallenberg syndrome. Other names you should be aware of. Coming to the uterus plexus. It is a plexus of veins situated inferior to the posterior end of inferior turbinate. Okay, inferior to the posterior end of inferior turbinate. especially in case of aged adult. This is the main cause for bleeding in case of epistaxis in old age, okay, or due to the venous plexus, uterus plexus. This plexus is called uterus plexus. It is the posterior main cause for posterior epistaxis. Anterior epistaxis means little area, no? Likewise, posterior epistaxis uterus area. So last is the Brisberg cartilage. Brisberg cartilage is the other name for cuneiform cartilage. Srimati, where is cuneiform cartilage is situated? Ear, nose, and throat. Unmute yourself.
Ma'am.
Which part of the throat?
Ear, ma'am.
Ear.
Throat, ma'am.
Very bad.
Throat, ma'am. Throat, ma'am.
Which part of the throat? Pharynx or larynx?
Larynx, ma'am.
எல்லாம் தூங்கிட்டு இருக்கீங்க. So cuneiform cartilage is a small cartilage which is present retinal barnaculate cuneiform. No, very small. You cannot even see that thing. So this is again Vaima question. So other name for cuneiform cartilage. First you should know where it is present cuneiform. You should not tell ear. Okay. Here there is no such cartilage. Cuneiform cartilage is present in the larynx. The other name for cuneiform cartilage is Brisberg cartilage, situated in the aryepiglottic fold. Okay, arytenoid, cuneiform. What are the three cartilages which are present one by one there in the aryepiglottic fold? Sindhuja. Sindhuja. Unmute yourself. What are the cartilages present in the aryepiglottic fold? Just I told you. Sindhuja, write the name of Sindhuja. She is not hearing something. She is doing something. Yeah, you tell. What are the cartilages present in the aryepiglottic fold? Arytenoid, above which? What are the three small cartilages present in the aryepiglottic fold?
Arytenoid, cornicate, cuneiform.
Yeah, correct. That's all. Only three. Okay, so that's very smallest. This thing is the cuneiform cartilage, which is otherwise called Brisberg cartilage. It is a fibroelastic cartilage and does not undergo calcification. So you won't be able to see even in an X-ray. Okay, that's all today's class. I think then with the for your batch only we have taken extensive classes and so many classes. Okay, so far for your senior also they have not tested these nuggets and all. So we are forced to take classes. There are so many classes for you because we are sitting in the home and chatting. Okay, read properly.